my pleasure to update you on the data we presented at ASCO on Checkmate 142. As you know, this was a multi-cohort study, phase 2 study, and the cohort I'm reporting is the MSI-high metastatic colon cancer patient cohort treated in first line with nivo and ipilimumab. The data were presented originally in ESMO last year with a median follow-up of 15 months. This ASCO, we presented a median follow-up of 24 months. And what is exciting is that the response rate, the efficacy of this combination has improved and increased. The partial response rate is now 69%. And what is extremely exciting is that 13% are complete responders. So with longer time, we see increasing efficacy of the first-line immunotherapy combination of a PD-1 and a CTLA-4 inhibitor in this patient population. The duration of response, the duration of progression-free survival, and the duration of overall survival have not been reached. The 2-year PFS rate is still 74%, and the 2-year overall survival rate is 79%, indicating incredible lasting response rates and control of disease in this patient population, which is known not to do very well with chemo or target agents, indicating and further supporting of a very robust and durable effect of this immunotherapy in this particular molecular-defined patient population. There are no new safety signals. It has been extremely well tolerated. Only 7% of patients discontinued because of side effects. So we are very excited about it. And I'm sure you also heard the clinical trial outcome data on Keynote 177, which also showed that pembrolizumab is significantly superior to chemotherapy in this patient population. What is interesting, and maybe the difference is fully understanding that Checkmate 442 is a much smaller study with 45 patients, is we don't see the 30% progression of disease. So there are a lot of questions raising how important are CTLA-4 inhibitors? Will they change the potential efficacy in first line? This needs to be further explored, investigated. But certainly the MSI-high patients benefit in a significant way from immune therapies. Whether we need CTLA-4 inhibition needs to be explored in future studies, but there is certainly now interesting data showing that this combination is very effective and long-lasting with no significant side effect issues. So I think if you see a patient tomorrow in your clinic with an MSI-high metastatic colon cancer patients, you should consider immunotherapy. The data of Keynote 177 as well as Checkmate 142 are very clearly demonstrating a high efficacy, and in the Keynote 177, a higher efficacy than chemotherapy. We already knew MSI-high tumors do not well with aggressive chemotherapy or any of the target agents. As you know, the NCCN already included nivo-ipi as a first-line treatment options in patients who may be not candidates for chemotherapy. So this is already in our guidelines, and we should act on it, particularly with further data presented at this ASCO with Keynote 177 and further longer follow-up with continued high efficacy profiles with nivo-ipi.